Hello, Lil. This is Michael Ann Morgan, and I am going to do the part of my video that has to do with the examination of the female male genitalia. It's the part of the assessment that, of course, we didn't actually do on an individual because that would be a little awkward. Um, First, I'm going to talk about the breast and the axilla. Um, when we're examining these areas, we need to have the patient sitting on an examination table with their arms hanging down to their sides. We need to just observe both breasts and compare them for, symmetry, size, contour, any retractions or dimpling. We need to look at the skin color and the texture. Of course, we look at the venous patterns, any lesions or supernumerary nipples. Then we're going to go down and inspect the areola and the nipples and compare them for shape and size, symmetry, color, smoothness. We're looking for any nipple inversion, eversion, or retraction. We're going to re-inspect the breast with the patient in different positions. So we'd have their arms up over their head, their hands pressed on their hips, their hands pushed together in front of their chest, seated and leaning over, and in the recumbent position. We're going to palpate the breast symmetrically in all four quadrants, and the tail is spent and over the areola for lumps or nodules. If the breasts happen to be large, we're going to do a bimanual palpation. We're going to palpate the nipples. We're going to compress gently to observe if there's any discharge. We're going to palpate for the lymph nodes in the apex, the medial and lateral aspects, the anterior and posterior walls of the axilla, and the supraclavicular area. With the patient sitting and supine with one arm behind the head and towel under the shoulder, we're going to palpate the breasts also. So that's it for the breast and axilla part. Thank you very much.